So the last of the presentations I'm going to be doing is about calculations involving information retrieval. And this is about looking up information in standard texts. Usually, from the point of view of pharmacy, that's probably going to be the BNF in normal practice. So if we think about calculations using the BNF, at the very beginning of this whole series of calculations lectures, I went through a case about a child, a 4-year-old child, rushed to hospital. So she was having real problems. She weighed 15 kilograms. I'm not going to go through the whole thing again, talking through it, because you can go back and see from the previous presentation. So we have all the information about this salbutamol, about how it's to be given. And so the scenario is that the doctor followed the instructions given in the children's BNF and wrote down the appropriate wording as it should be. So 2 micrograms per kilogram per minute to be given by continuous infusion equals 30 micrograms a minute. So this was something that had to be worked out, because the nurses who were administering the drug needed to know how to get to this amount. So the pump machine could only be set in mils per hour, so they had to work out how many mils per hour rather than number of milligrams. They had a 1,000 ml infusion bag of saline to dilute the salbutamol. They tried to work it out for a while, found it was quite difficult, and they called the on-call pharmacist for help. Okay, so here's the issue. The dose is 30 micrograms per minute, or 1800 micrograms per hour. Obviously, that is the 1800 micrograms comes from the 30 micrograms times 60. I should say times 60. Okay, that gives us 1800 micrograms. In each vial, we have 500 micrograms, and that, sorry, 5,000 micrograms. Easy mistake to make, as we'll see later, in a 5 ml vial. So 5,000 micrograms is the same as 5 milligrams. And that needs to be diluted to 500 ml. So that's what we have. So the idea was that the nurses could add 2 5 ml vials to the 1,000 ml bag. That gives 10 mils in 1,000 ml. And that would be 10,000 micrograms or 10 milligrams. So 2 5 ml vials, 2 5 milligram in 5 ml vials. The child needs 100 micrograms per hour. So that's how much they need in terms of the drug, but we have to set the pump in mils per hour. So what we need to know is to how many mils of the drug we need to give to get the right number of micrograms. So the idea was it's 1800 divided by 10,000, because that's the number of mils we've got, and then times 1,000 to get our answer, and the answer came out at 18 mils per hour. So they removed 10 ml from the litre bag, added 2 5 ml vials, they set the pump to deliver 18 mils per hour. Very, very sadly, the astute amongst you will have seen that that was wrong. What happened was they only gave 180 micrograms per hour rather than the 1800 micrograms which was needed. And that was 10 times the wrong dose. So you can see how important it is that the simple calculations are done correctly. And it's really, really sad, and really sadly the little girl died. That's the consequence of not being able to do your calculations and not fully understanding the importance of them. Okay, so What I want you to do is have a look at the following issues. All three questions that follow are based around drug A, and this is the information you would get about drug A. So it tells you what it's for. These are known as the indications. So for mild infections is the indications. By mouth is the route that it's given, obviously. It can also be used for early syphilis when you use a higher dose on there to help sort that out. But you can also give it by intravenous infusion. So these earlier doses are by mouth, whereas the intravenous infusion obviously is about having a continuous drug amount coming into the body. And the next slide shows you what formulations of this are available. You have tablets, which are 250 milligram tablets. There's only one strength of tablet. There are 3 strengths of oral suspension: 125 milligrams in 5 ml, 250 milligrams in 5 ml, and 500 milligrams in 5 ml. And there's also an intravenous powder which comes in a 1 gram vial, 1,000 milligrams. So, as I say, all of the next 3 questions are based around this drug. So the first is, well, I'll let you read the questions and go through them yourself. So pause at each one and try and work them out. And having gone through those, what I'm going to do is talk you through the answers. So question 1. What dose and strength of suspension of drug A would you prescribe for the patient? So the dose that we have is 500 milligrams 4 times a day, which we abbreviate often to QDS. And we'll use the 500 milligrams of 5 ml suspension, 1 5 ml spoonful 4 times a day. The total quantity that we prescribe is 500 milligrams 4 times a day for 14 days. So it's 5 mils 4 times a day for 14 days. That's 280 mils. And the total quantity prescribed would be 500 milligrams 4 times each day is 2 grams a day. 2 grams a day for 14 days is 28 grams. You can have a look at these. Any problems, just email me with what the issue is. So we have a neonate in question 2, a mild infection. And the dose and daily dose. So we have 12.5 milligrams per kilogram. So it's 3.5 times 12.5. That gives us 43.75 milligrams every 6 hours. That's 4 times in a day. So our daily dose is 175 milligrams. It's 4 times 43.75. Okay, which strength of suspension should be used? Well, we tend to go with the one that's closest. So the 125 milligrams in 5 ml will be our most likely one to use. And to work out how much should be given for each dose, the suspension we're using has 125 milligrams for every 5 ml. And one way you could look at that is to say, well, okay, for each ml, there's 25 milligrams. And we need 43.75. So therefore, we need to divide 43.75 by 25 to find how many mils we need, which comes out to 1.75 mil of the 125 and 5 mil suspension. And we would probably give that, you wouldn't really be able to measure that on a spoon, so we'd use an oral syringe for this. Number 3, so total dose of drug A required 24 hours. We've had to work out the ideal body weight from tables because we weren't given the weight. So therefore we've gone to the BNF table. It tells us it's 18 kilograms would be the average body weight. If it's 50 milligrams per kilogram, then we need 900 milligrams every 24 hours. So in milligrams per hour, we just simply divide by 24 because we're 24 hours in a day. So that's 37.5 milligrams per hour. We then need to work out what volume of infusion fluid. So this is where we need the strength of the fluid, infusion fluid, and it's 37.5 milligrams per hour. Strength of the solution is 2 milligrams per mil, so we need 37.5 milligrams. 37.5 in 2 mil is 18.75 mil. So the concentration in the infusion fluid is what we needed to know really to work out the previous one. So drug A is a 1 gram vial. So we've got a gram or 1,000 milligrams, and that's put into 500 mils. So we have 1,000 milligrams in 500 mils, and that is 2 milligrams in every mil. And another way of expressing that is 0.2% weight volume. If you have any problem with working these out, I've also put some I've worked through each of these questions so that you can have a look at it in separate videos on Student Central, on My Studies, and you can have a look through there to see if that may answer any questions you have. So the important thing is to work stepwise, keep it simple, and calculations are not impossible. They're very far from impossible. Calculations are always better with practice. Everybody has to practice them. Every year that I come along to do the calculations lectures, I have to do a bit of practice before I do the presentations. So it is purely a matter of keeping it in mind.